Everything works. Hmm. All right, we'll be getting started shortly. Waiting on Dr. Peter to get on. Mm. Bree Love, appreciate you tuning in, man. Mm.
Good morning.
Good morning, morning, morning. How you doing?
I'm good, thank you. How are you, sir?
All is well, all is well. Man, thank you for taking the time out. I know it's been a long process of us trying to figure this thing out, but we got it done.
Yep, a lot of back and forth. I'm sorry I'm a little bit late.
Nah, it's fine. It's perfect. It's perfect. So, man, just wanted to start it off. We have a couple people who've already tuned in, and I'm going to end up recording this and putting this on our YouTube channel.
Okay.
But just want to start off with an introduction of yourself, and your position with the Raptors.
Peter Incanza is my name. By training, I'm a dentist and a specialist in dental anesthesia. With regards to sports dentistry, the Raptors specifically, I've been their only dentist as it works out, and so I've been with the team since their beginning, their first season, 1995, and
Wow.
so 24 seasons under my belt, and I believe number 25 is coming up, and we have now the Larry OB to celebrate with. So it's been a fun run. Yeah.
Awesome, awesome, awesome. And that's an interesting thing, with the Raptors just winning their first championship, and kind of getting over this hump? Like, what does that mean? What did the championship for Toronto mean? What did the championship for Canada mean?
Well, it meant an awful lot. I mean, the introduction of Canada to basketball, the NBA, happened in 1995. It happened in Vancouver and in Toronto. As it works out, the franchise in Vancouver ended up moving. They're in Memphis now, the Memphis Grizzlies. But Toronto always had a very strong backing from the very beginning. It's been a tough slog. You, as an expansion team, you start at the bottom and you work your way up. And usually you're staffed at the beginning part with a bunch of folks players who feel they're undervalued. And generally speaking, the administration doesn't know what they're doing either, because the NBA is a different beast from all the other professional leagues that are out there. But slowly you kind of keep your head down. If you stay in your lane, you do the best job that you can, and it starts to grow. I think probably even from the beginning season with Damon Stoudemire, he was our first draft pick, and went on to win Rookie of the Year. Having Isaiah Thomas gave us a little bit of cachet as well, so that was very helpful early on. And then we hit sort of the lean years. And then Vince Carter came on board. And of course,
Vince Carter, yeah,
he really put basketball, I believe, on the map here. Just as an athlete, no one has really seen anything like that before or since. It's wonderful that he's still playing. He's decided to come back for year 22. I very much like Vince, but he's the guy that I think really made the difference and started the true interest here for basketball in the NBA and the Raptors. And that sort of went away when he left. And then we sort of came back, Chris Bosh in that era. And then, of course, he left, went to Miami. And, fortunately, he won a championship as well. And then Kyle and DeMar came. And the team just sort of steadily got better under Dwayne Casey. And the leadership got sorted out. The ownership got sorted out. Everyone, after about 15 years, we understood what we were doing. We had a new dedicated facility, and the city was really starting to have a groundswell. As we got a little bit better year after year, that's where I think the interest and probably you saw the Vince Carter effect happen at that point, because some of the people who would have seen him play when they were very young just sort of became a little bit older, either became basketball players themselves or became basketball fans and understood the game a lot better. The understanding, I think, of basketball has improved immensely over the last 25 years, 24 years. And that's in part due to the media. They've done a very good job in teaching, but also because it's just an exciting game to watch.
100%.
Go to the last 5 years or so when the Raptors have been consistently very, very good, but not had very much success in the playoffs. But one of the wonderful things about sports is that, every year you start again and nobody's in first and nobody's in last and everybody has hope. And so you go ahead and play. We knew we had a good team coming into last year. We didn't know how good. We didn't know how good everyone else would be. In the end, the team did very, very well, obviously, won the championship. And in the end, we had just a wonderful run. But I'll tell you something. The thing that I think we learned, one, is that there's more support than we thought there was for basketball in the country. And two, it's very, very hard to win a championship. Very 100%. Hard. The stars have to be aligned for you. They were for us. And we have the trophy that nobody can ever take away.
Awesome, man. And I'm glad you made that point, because I was actually checking out there's a Netflix documentary called Vinsanity that kind of explains like how Vince kind of changed the dynamic of basketball in Toronto and in Canada. And for you being able to see that firsthand from, the transition to people being able to come to the games and, not, this team being like the throw off team, essentially that's how it was. It was almost like players were getting shipped out there and they were kind of uninterested in the environment. The fans didn't know how to support them. That this was a new environment. And for you to see transition and now turn into a whole championship team is amazing. So kudos to you guys and congrats again. So I took a couple questions for some students, and I wanted to kind of ask you about it. As a sports dentist, but, foundationally, you're a dental anesthesiologist, right? And I have never heard of that before until I was checking out your profile and your bio. So kind of explain, what the day-to-day of a dental anesthesiologist is. I'm sure it's dealing with, some medically complex patients or like frequent gaggers or just anybody that's probably the biggest fear, now that I'm entering clinic, that's probably the biggest fear of patients coming in is just like so many people are afraid of getting the anesthesia or getting the shot. You know what I mean? So kind of explain like what your day to day looks like as a dental anesthesiologist.
Sure. Well, the day to day is that I run a general practice. There are
Nice.
different ways to practice dental anesthesiology, and one of them is that you can do the dentistry and the anesthesia. The other way is that you simply drop your handpiece and you just do the anesthesia for other people to do the dentistry. I do a combination of both. The third practice style, I suppose, is that you only do the anesthesia, but you end up going from office to office to go ahead and do that. So you would travel and you go to their facilities and provide anesthetic, again, only anesthetic services for them. Again, I do sort of the first two. So I do have a home office. I do have my own patients. About half of them have sedation, and I do have a number of visiting practitioners that come in, and then I'll do just the anesthesia for them. With regards to my day-to-day, it's a general practice. It's a busy general practice, and I guess since half of my patients have sedation at some level, then we have to book a little bit differently. But they can have sedation for any reason. They can have, generally speaking, anxiety is going to be the reason. Gaggers, yes, can be treated. Medically complex, you need to be a little bit careful of, because if they're not healthy to begin with, then you want to make sure you don't push them over the edge. So we do very careful consultations on anybody who's going to receive sedation, or really anybody who's going to receive dental work. But we do very careful consultations, and if we require medical consultation as well, we need to get the clearance. We really need to get our ducks in a row before we start the process of the anesthetic. But generally speaking, it's done very well for us. It is a topic of interest. Dental anxiety is absolutely real. It has been measured and studied, and it affects millions of people, not only in Canada, but in the US as well.
100%.
In regards to dental anesthesiology as a discipline, as of this March, actually, I was declared a specialty by the ADA. So
Wow.
now in the United States, the 10th dental specialty is dental anesthesia. In Canada here, it's recognized only in the province of Ontario as a specialty, but most of the provinces treat it like a specialty, even though it's not nationally recognized. With any luck, that will happen over the next little while. So really, my particular practice happens to be a general practice where patients have the option of coming in and having sedation for it. That portion of my practice is largely referral-based practice, so other general practitioners who don't do sedation or have a difficult time managing their patients will send their folks in. Very occasionally, I'll also have people come in who have local anesthetic issues, and so they can't get further for one reason or another, and they still may not want to have sedation for their work, but part of my, I guess, umbrella also encompasses doing advanced local anesthetic techniques. So I've had, to this point in time, very good success in getting people frozen who sometimes otherwise couldn't be.
Awesome. Awesome. Now, do you have to, with you being the dentist for the Raptors, are there some of the players that need sedation as well, that you have to take care of, based on anxiety or anything like that?
That's tricky. So the answer would be, in their world, yes. The answer in my world is no, because there's a very extensive list of medications that you cannot give to the NBA. And so if you violate that, you have to then sort of submit a letter to the NBA that says, well, here's what they had, here's who gave it, here's why they had it. If you're drug testing anytime in the future, then please be aware that you might find some of this stuff. So for the most part, and I guess the other part of that answer, is that when you have sedation, it's going to take time to recover. One of the things that's really bad for professional basketball players is downtime. So it really kind of doesn't matter why. So I need to fix the teeth, but I need to, generally speaking, fix them awake so they can go back to whatever they were going to do for the balance of that day. So sedation is an option for them. Usually if they're going to receive it, which is rare, if they're going to receive it, it's probably going to be a light sedation. And then they just go back to their business as normal. The fewer disruptions that I can create for the players, the happier the team is with me.
100%, 100%. Now, being in this environment of, there's other healthcare professionals being on the team. What kind of collaborative efforts do you guys come together to do in regards to kind of making sure that the players are kind of, at their optimal level? I know a lot of people don't really understand the role a dentist will play on the team outside of like maybe providing mouth guards or something like that. And, I just wanted you to educate people on like, if there's an NBA game going on, like what role would you play during the game, or like even preseason, what role would the dentist play within the game or kind of within the network of other healthcare professionals?
Right. Well, I'm very lucky in that the folks who are the medical directors of the team are very collaborative with me.
Awesome.
As it works out personally, we've actually been friends for 40 years anyway, so we knew each other before the Raptors came along. But
Awesome.
as the time has gone on, we've come to become a very good team together. So we certainly all respect each other's lanes, and we're always there to help each other with whatever it is that we need to do. The hierarchy is there really from the standpoint of a bureaucracy. So who is it that needs to speak to who, or who needs to be behind that closed door meeting? And generally that's not me, understandably. I'm the dentist, and so the orthopedic surgeon, one of our orthopedic surgeons, is the medical director, that's Paul Marks, and the other physicians who is on staff is Dr. Howard Petroff. And so they've done a terrific job. Again, they've known each other for very, very longer than I've known them, and I've known both of them for a very long time. The rest of the team, the health team, the head trainer, Scott McCullough, has now been around for a long time as well. Our director of sports science, Alex McKechnie, whose name pops up in the media quite a bit because the whole field management thing with Kawhi last season was largely his brainchild. But the five of us, plus more, physiotherapists, massage therapists, it's all just a team. The strength and conditioning coach, we just all talk whenever we need to talk. Everybody stays in their lane. Everybody respects each other because very few people are new to the team. We've been very lucky to have a lot of stability over the last decade or so. And so we just all have faith that we can each do our roles, and we have trust and care for each other. So if anybody needs a helping hand, then we do that. All this stuff starts in the preseason. The day before training camp opens officially, we do have a day where we screen all of the players and the trying out players. And we do blood tests, and we do eye tests, and we do hearing tests, and we do dental exams, and we do molds for that, and we do fat calipers, and we do, so it's sort of a bunch of different stations where the players are going to come in and reintroduce themselves after the summer. And at that point, every player has a big binder. They've had heart work, they've had blood work, they've had tooth work, they've had orthopedic work, and it's all compiled into a big binder that then follows them for the balance of the season. So if anybody has anything that happens even throughout the season, essentially you pull out the binder, you see where you were, you add your notes to it, and the records are kept for all of those players throughout the season, as long as they're Raptors anyway.
Perfect. I have a quick question. So, during the playoffs, one of the key moments of the playoffs was when Fred Van Fleet, he got hit in the mouth and chipped his tooth. So I wanted to know, were you involved in that process? Did you have to make any changes or anything like that? Because that was a pretty a big major injury at the time.
It was, yeah. It took Fred out of the game for that game, and that unfortunately was they were in California. Now I don't travel with the team, and so in that particular case, it was on a Friday, and Fred got hit, went down. Obviously, had the cut underneath his eye, which is one thing, but also chipped his tooth. So the cut underneath his eye, that wasn't really my concern. Although I will say parenthetically that literally the week before, we had just taken 5 stitches out of his other eye. So he's a guy who doesn't mind sticking his nose in there and taking his lumps.
Making it happen. Yeah.
It happens. And, this is obviously a very fluke accident with Sean Livingston hitting him with the elbow. But, as it works out, yes, there was a tooth that was damaged. And yes, there was a close-up of the tooth or a piece of the tooth on the floor. After that close-up, it was very funny because my email and my cell phone immediately went crazy.
Yeah.
As it works out, it was a Friday. They were coming back the next day anyway on a Saturday afternoon, evening. I did see him in my office, and I was able to go ahead and patch things up for him and diagnose it properly. They did a good job for what they did out in California, but it wasn't very much. Again, after the game, they were essentially right back on the plane and came back out here after a good night's sleep. But I did have a chance to look at him, and he was okay to smile for the balance of the series. And so, sort of divulging the sort of things that would breach patient confidentiality, I did see him, but I saw him the next day. And that would be as close as I could get in that particular circumstance. Had he been here, yes, I would have seen him that evening. And had that have happened to a Golden State Warrior while they were here, assuming they didn't travel with their dentist, and they didn't, then I would have been responsible for that player.
100%. And that's one thing I love educating people about is that, as a team dentist, when visiting teams come to the arena, you're looking over them as well. So you're not traveling with the team. You know, you're taking care of both the visitors as well as the home team as well.
To whatever extent I can. And again, the
Okay.
playoffs, everything changes in the NBA. In the playoffs, that's where your money is made. That's where your reputation is made. That's what really rests the future financially and reputation-wise for the franchises. So what ends up happening is people become very, very guarded in the playoffs in terms of what medical assistance they're willing to open us up to. In theory, we could be, I suppose, spies. And if someone hurts their ankle and we sort of do the examination, then it becomes well, by the way, let me tell you, coach, that so-and-so actually has hurt their ankle very badly, irrespective of
Wow.
what your report is. Now, that doesn't really extend to dentistry very far, because what's the issue going to be unless it was already an infected tooth that was having a problem? So generally speaking, if it's going to be a traumatic injury, which is why I would be called to the floor generally speaking, then they'll trust me to go ahead and deal with it as quickly as possible. But the playoffs is a different beast, and depending on the team and depending on which round you're in, you may or may not get a chance to see them. So in our first series this year in the playoffs, we played against Orlando. They did have an issue with one of their players, and they did invite me in. Later on against Milwaukee, which of course was the Eastern Conference Finals, they also had a dental, what I believe was a dental problem, but they didn't let me come close. So it was like, okay, that's fine. And, we offered our services, and if they say yes, terrific, happy to provide them. And if they say no, it's their team, they can do what they want. And so in that particular, the Milwaukee series, I did not see anybody, although I know they needed. And for Orlando, I did. It's just different depending on who you're playing, when you're playing, and how far along you are in the playoffs.
100%. And another thing is, so outside of just dental work, the dentist is also controlled of basically treating any of the head and neck injuries. Is that true? Like lacerations, anything like that?
It could be. So our third physician, our second physician, Dr. Howard Petroff, that I mentioned before, he can kind of deal with anything that's medical. So head and neck. If you're outside the mouth, he'll probably do it. I may be there with him. If it's inside the mouth, I'll probably do it, and he'll be there with me. But again, he and I have known each other for a very long time, and so we're very happy to, whoever feels more comfortable doing whatever it is after we examine it, then we just, okay, you want me to help you or you want to help me? And, so, and times we've had debates about who goes first, which is, I guess, the good problem to have, as opposed to fighting about, this is really my call, get off my turf, that we've never had that conversation. So it's always been very cooperative, and whoever's most comfortable with doing sutures on the lip. I mean, he's an emergency physician, emergency room physician.
Nice.
So certainly cut lips are nothing new to him, and he's happy to go ahead and do it, but he knows that I'm a dentist, and so he's happy to have me do it. It really kind of depends on what the nature of the injury is, but we'll both have a look at it. We'll look at each other, we'll speak about it, and then we'll just decide what the best therapy is at that time. But again, very interactive, very cooperative.
Nice. All right, so I'm gonna go back to some other questions. I have about a couple more, probably about 15 more minutes, 10 more minutes, and that'll probably be it.
Okay.
So this comes from a student. I'm actually gonna read this off Instagram. I posted a picture on Instagram and had people write some questions that they wanted to ask you. So this comes from a student, and she says, when my patients ask about whitening, I always try to gauge their level of sensitivity. So what are some pre and post whitening recommendations you would give to your patients?
Well, there are high fluoride toothpastes, high fluoride content toothpaste that you can use, and sensitivity toothpastes that you can use. I would do that. Sensitivity as a side effect of whitening occurs, my understanding, about 30% of the time. Now that's going to depend on first of all, their predilection towards sensitivity, and
Right.
second of all, which particular formulation you're using. So there are lots of different ones out there: day white, night white, et cetera, et cetera. I mean, I can't go through them all, but certainly they're all out there. They all activate in the same way, obviously, with hydrogen peroxide, carbamide peroxide. But it really becomes, I think, more a function of having a conversation with the patient and deciding whether or not they have sensitive teeth going into it. If they do, then warn them and have them probably pre-treat for a week or two with a sensitivity toothpaste. And then they need to know that, you can always stop whitening. So if it's a home kit, you try it every night, and then if sensitivity occurs, generally speaking, it tends to be in a bit of a square wave. So it's not there one day and then all of a sudden it is. And then if you stop doing it, it just goes away again. So because you get sensitive teeth during the whitening process doesn't mean it's going to stay. In fact, I've never come across a case yet, at least in my office, where the sensitivity is permanent because of whitening.
Mm.
But I would pre-treat with something that is going to decrease sensitivity. And if you know that you have gum exposure or something like that, it may not be a great choice for whitening, or to use a slightly lower concentration of the carbamide peroxide, which will take longer, but have patience and be more comfortable.
Awesome, awesome. All right, I got a couple more questions and then we're gonna finish up. So, for students, a lot of people, sports dentistry is like, for me, I feel like I'm pretty active when it comes to the dental community and you're looking at different opportunities and different avenues. And sports dentistry was completely something different that I never heard about until just kind of my own personal research, right? So if there's students out here that are interested in the field and interested in maybe going into the NHL or the NBA, what do you feel like some steps they could do while they're in dental school or like post dental school to kind of align them with a sports dentistry career in the future?
Well, a sports dentistry career is difficult to do. So first of all, there aren't many spots. And so there are 30 NBA teams, which means there are 30 NBA dentists, and that's it. That's just not a very big number.
Yeah.
For the NHL or anything else, it's going to be very difficult. Having said that, to be involved with sports is quite easy. And so many lower level sports, semi-pro, amateur leagues, colleges, universities, high schools, rep leagues, they're always looking for help. They can also, so there's that with regards to community experience. Once you're out there and working, you can even sponsor mouthguard clinics, and that puts your name on the map, sort of. And then the leagues may look to you and they may call you when emergencies arise, but can certainly put your foot in the door. Otherwise, if you want to do the actual didactic learning, then there are the academies of sports dentistry that are out there, and I would absolutely encourage membership in those. Depending on where you go with that, you can be international or national with regards to those groups, and they will have annual meetings. There's one in Toronto, as you know, in June.
Yes, sir.
So those are terrific organizations. They're all like-minded practitioners. And so I think those are great places to go, great sources of information, and it's a good networking opportunity for you. But otherwise, I think from a curiosity standpoint, have a look at what's in your community. My first, I suppose, dental gig was actually covering the University of Toronto Varsity Blues, and I still do that. Now, it's a very unofficial and very hands-off situation, and if they need me, they call me, but I've been around for them since 1993. And so that's a good long run. And again, they don't use me very often, but they know that I'm there. And so certainly you have the opportunity just by approaching your own, wherever you're going to dental school, why not just approach them and find out if they would like some help or if they need some help with their screenings for their field hockey team, football team, for their water polo team. There are a lot of sports that are sort of underrepresented with regards to dentistry. My suggestion there would be find the sport that you like first, and then go ahead and offer your services. I have been asked to do the Toronto Maple Leafs here in town.
Nice.
It was sort of a side conversation, but I'm not interested. I'm not really a fan of hockey. So I'm not interested in watching 41 games a year where I have to be there, and I just, no, thank you. My question was, if I say no to that, do I then lose the Raptors because you guys will be upset with me? It's the same owners. And they said, no, you keep the Raptors. We just like to know if you'd like to do the Leafs as well. And I said, well, if my Raptors job doesn't depend on it, then I'll respectfully decline.
Yeah.
As it works out, I covered the soccer team here as well, the Toronto FC. And again, that's more or less hands-off, but I do see those players and their administrators as well. So it's really a function of hang around, do the best job that you can, be nice to be around. I think, all sports seasons are long. They're all sort of 6 months, 5 months, 8 months. And so if you're not a good guy, you're not going to last, and because people aren't going to want you around. They really have to live with you for quite a while. And so my particular approach says, well, let me just do my job, stay in my lane, don't speak unless I'm spoken to, and then do the best job available. And that seems to have paid off for me.
100%, 100%. Last thing, so I've had a conversation before with the Brooklyn Nets dentist and a couple other sports dentists, right? And I think the perception, like outside looking in, when somebody says, okay, he's the dentist for the Toronto Raptors, they're always thinking about like, okay, well, how much is this person getting paid for this position, right? So I had the conversation with the Brooklyn Nets dentist, and he said it was more so like an exchange of service. Like I'm exchanging a service, and I get the marketing rights, I get access to the games, the networking, the opportunities. So I wanted to know if that was a similar type situation with you, or were there other additional perks or financial gain from the opportunity?
Financial gain, no. So this is pro bono work. I'm not under contract actually with the team, so there's no financial benefit for me. I haven't entered into a marketing agreement with them because I'm not interested in doing that. The Raptors, the sports dentistry, is an important part of my life personally, but it's not a particularly important part of my life professionally. In that, I'm not looking to expand my brand somehow, because without trying to sound non-humble, I don't need to do that. At least not through sports dentistry. And so people who know that I'm the dentist of the Raptors, but otherwise I actually prefer that they know that I'm a good dental anesthesiologist as opposed to being the dentist of the Raptors.
100%.
I'm not sure what that says in terms of being a dentist for the Raptors. That, for me, it was a function of being in the right place at the right time and then continuing to do a good job. On the other hand, being a dental anesthesiologist, which is where my extended training is concerned, that's more important to me. That part of the reputation is more important to me. So financial gain, there probably is some. I haven't measured it. It's not direct from the team, and so the team doesn't pay me. With regards to perks, I do get to attend the games, and I do get to sort of wander through the stadium. So I kind of have carte blanche that way. Again, it's not a situation that I've ever taken advantage of, and if you do, you lose your job. Because you're not a fun person to be around, you're not a good person to be around, you're a sneaky person, or you're a self-centered person. In my opinion, none of those things work in a professional organization. So you need to not be that. I try not to be that. And so far it's worked out. And here comes year 25. But from a financial perspective, there's really no reward.
100%, 100%. All right. Well, want to thank you for the conversation. If you have any final words or any conclusion, I just want you to just close us out with anything you might have for any of the students, any of the people that are tuned in live right now.
Sure. I guess my last final word, first of all, would be to thank you, Devontae, for this opportunity. It was a lot of fun actually doing this. Second of all, as Shakespeare said, to thine own self be true. And so when you have your opportunity to become an independent professional, which you will when you finish dental school, choose your path and then follow it faithfully and do the best job that you can. Don't let people sway you. If it doesn't feel right, don't do it. If it's not the sort of thing you want to do, don't do it. If you do choose to do it, do the best that you can and be as honest as you can with yourself and with everybody else all the time. And you'll always be able to go to sleep at night peacefully, and your career will do just fine. So, good luck to all the people who are dental students out there and just entering the dental profession. I think it's a wonderful and dignified profession to be a part of, and I'm very happy that this is what I do for a living, and I make no apologies to anybody for that. So to the best of luck to you, certainly, Devontae, for your dedication to what you're doing, and to anybody else who might pay attention to the video here.
Awesome, awesome. Well, thank you, everybody. Thank you for tuning in, and that concludes Tell Me More.
Thank you very much.
No problem.
Bye now.